G-tube feeding by the syringe method using the ENFit port. In this video, you will learn what is a G-tube and why you may need one, how to feed yourself using your G-tube, how to prevent your G-tube from getting blocked. This video shows a caregiver helping a patient with her G-tube. Some patients may not need help. You may be able to use the G-tube yourself. This video will use the word "you" to describe actions you or your caregiver can do. What is a G-tube and why you may need one? If you have an illness, side effects, or had surgery that makes it hard to eat and drink, you may get a gastrostomy tube, also called a G-tube. A G-tube allows formula is liquid food, water for hydration, and medicines approved by your doctor to go directly into your stomach. A G-tube is a thin, flexible tube. One end is placed in your stomach, and the other stays on the outside of your body. A G-tube has several parts. The balloon is filled with sterile water and keeps your G-tube in place inside your stomach. The bolster is a piece of soft plastic that sits on top of the exit site. The bolster keeps your G-tube from moving further inside your stomach. The exit site is the area of skin on your belly under the bolster where the feeding tube comes out. The end of your G-tube has 3 ports that may look like this. This type of port is called an ENFit port. The feed port is where you will give yourself formula. It may have a label that says feed or feed only on it. The medicine port is where you will give yourself medicine if needed. It may have a label that says medicine or enteral meds only. The balloon port. Only a nurse or doctor should use this port. Incorrect use could cause the G-tube to come out of your stomach. This could lead to a serious infection or the need to have the G-tube reinserted or replaced. Never use this port. How to feed yourself using a G-tube. This video will use the words feed or feeding to mean giving yourself formula. There are 5 steps to feed yourself through your G-tube. Step 1. Clean your work area and gather supplies. Step 2. Flush your G-tube. Step 3. Feed yourself formula. Step 4. Flush your G-tube again. And Step 5. Clean up after the feeding. Step 1. Clean your work area and gather supplies. Choose a clean and dry work area like a table. It should be next to a chair so you can sit during your feeding. Before you put down your supplies, clean your work area using a disinfectant wipe or soap and warm water. Cleaning the work area prevents you from getting an infection from germs on the surface. The supplies that you need for feeding are formula. Formula usually comes in a can, bottle, or Tetra Pak box. You can buy formula at most pharmacies. Make sure that you only use a formula approved by your doctor or dietitian. Your doctor or dietitian chose a formula for you based on your diet-related needs, medical history, and current health. Talk to your doctor or dietitian if you have trouble finding the approved formula. Also, if you see a different formula that costs less, ask your doctor or dietitian if it is right for you before using it. Do not put blended or pureed foods or liquids other than water into your G-tube. Anything other than formula, water, or approved medicines can block the G-tube. Make sure your formula is at room temperature. Cold formula can cause pain or cramps in your stomach or belly area. If your formula is cold, let it warm to room temperature for 30 minutes. Do not leave open formula out for longer than 8 hours. Germs grow faster at room temperature. Leaving the formula out for longer than 8 hours increases your risk of getting sick. Do not heat formula up in a microwave or on a stovetop. If it is too hot, it can burn you and damage the G-tube. The next supply is an empty glass. The empty glass will be used to hold the formula. A glass of room temperature water. Room temperature water is used to flush your G-tube. Like the formula, make sure your water is at room temperature, not too cold or hot. 2 60-milliliter ENFit syringes. You will use one syringe to flush your G-tube and the other one to give yourself formula. A clamp your healthcare team gave you during your G-tube education. Clean towel or paper towel. Use a clean towel or paper towel to protect your clothes from stains and spills. After you gather your supplies, wash your hands with warm water and soap for 30 seconds. Always wash your hands before using your G-tube to prevent infections. Dry your hands with a clean paper towel. Use a clean paper towel as it is cleaner than a hand or dish towel. Step 2. Flush your G-tube. You must flush your G-tube with water before and after you have formula. Flushing your G-tube cleans it, keeps it working well, prevents it from getting blocked, and keeps you hydrated. You may be asked to flush your G-tube in between feedings to get enough water during the day. Talk to your healthcare team about how many water flushes you should do. To flush your G-tube, twist the cap off of the syringe. Place the tip of the syringe in the water. Make sure the tip of the syringe is below the waterline so that no air gets into the syringe. Fill the syringe with 60 milliliters of room temperature water. Aim the tip of the syringe up in the air. Squeeze a tiny bit of water out of the tip to make sure there is no air left in the syringe. Clamp your G-tube with the clamp. This will stop fluid from spilling from the G-tube when the cap is removed. If you have lost your clamp, you can pinch the tubing of your G-tube into a V shape using one hand. Stop pinching the tubing when the video says to remove the clamp. With the G-tube clamped, remove the cap of the feed port by turning it. Keep the G-tube clamped and insert the tip of the syringe filled with water into the open feed port. Turn the syringe until it stops turning. This locks the syringe in place. Remove the clamp. Slowly push the plunger on the syringe so the water goes into your G-tube. Take at least a minute to empty the syringe. Once the syringe is empty, clamp your G-tube again. With the G-tube clamped, turn the syringe to unlock it from the port and remove it. Twist the cap back onto the feed port. Take the clamp off your G-tube and put the cap back on the syringe. Only use water to flush your G-tube. Any other liquids besides water, formula, and approved medicines could block your G-tube. Step 3. Feed yourself formula. To give yourself formula through your G-tube, first, shake your formula so that it is mixed well. Unmixed formula can block your G-tube. Open the formula and pour it into a clean glass. Remove the cap from the syringe and fill it with formula. Twist the cap back on the syringe and place it on the table. Place a clean towel or paper towel under the end of your G-tube. Clamp your G-tube using the clamp. With the G-tube clamped, open the cap from the feed port of your G-tube. Keep the G-tube clamped. Twist the cap off of the tip of the syringe full of formula. Put the tip of the syringe into the feed port. Turn the syringe until it locks into place. Unclamp the G-tube. Slowly, push the end of the syringe so that the formula goes into the G-tube. To prevent bloating or cramping, empty the syringe slowly. Take at least a minute to empty the syringe. Once the syringe is empty, clamp the G-tube. Twist the syringe to remove it. Close the cap of the feed port and unclamp the G-tube. Place the cap back on the syringe. Wait at least 2 minutes. And then repeat these steps with another syringe full of formula. Repeat until you have taken the amount of formula your dietitian recommended. If you feel bloated after the feeding, at your next feeding, wait longer between each syringe of formula. Instead of 2 minutes, wait 5 minutes between syringes. Do not lie down during the feeding or for 1 hour after you are done. If you lie down, the formula could back up from your stomach and go into your lungs. When formula goes into your lungs, it can damage them or cause an infection. This is called aspiration. If during your feeding or soon after you have diarrhea, loose or runny poo, nausea, feeling like you need to throw up, or acid reflux, also called heartburn, contact your healthcare team. Step 4. Flush your G-tube again. Wait at least 2 minutes after you finish your feeding, then flush your G-tube again with 60 milliliters of room temperature water. To flush your G-tube, follow step 2 of this video. Always flush your G-tube after feeding to make sure it does not get blocked. Step 5. Clean up after the feeding. After each feeding, rinse the syringe that had formula in it with water. Take the syringe apart and rinse it until no formula is left. Allow it to air dry. At the end of the day, repeat the same steps for both syringes, but add a small amount of liquid dish soap to the water. Do not use any other cleaning products. Rinse well to make sure all of the soap is removed. Replace your syringes every 7 days. The syringes can become dirty, even if they get cleaned. If they get discolored or harder to use before 7 days, replace them earlier. Ask your healthcare team how to get new syringes. How to prevent your G-tube from getting blocked. To prevent your G-tube from getting blocked, flush your G-tube with 60 milliliters of room temperature water in the morning and night, even if you do not use your G-tube. Flush your G-tube with 60 milliliters of room temperature water before and after a feeding. No food or drinks other than your approved formula and water should go into your G-tube. Always shake the formula well before using it. Do this to make sure it is mixed well. If your G-tube has come out of the exit site, do not try to put it back in. Cover the exit site with gauze if you have some close by, or use a clean face cloth. Go to your nearest emergency room right away. For more information about your G-tube, including what you have seen in this video, review the G-tube Feeding by Syringe brochure. You can get a copy of the brochure online at uhn.ca. Search Tube Feeding by Syringe or scan this QR code at the Princess Margaret Patient and Family Library, or by asking your healthcare team for a copy. Talk with your healthcare team about any questions or concerns you have.